Good morning, YouTube. This is Gary from My Sacred Honor. Today I woke up and feels like I'm in a different kind of a world. And I've been thinking a lot on the healthcare and Cash for Clunkers program. And I think I'll hit the Cash for Clunkers. Try to say that 5 times. And it's kind of like a drug dealer who gives you a little bit of taste before they get you hooked. And that's what the government has done. They've given everybody a $4,000 up to $4,000 for their clunker and got them hooked on credit. So they buy a $25,000, $30,000 car, they got $20,000 to $25,000 worth of debt. Problem solved. Credit crisis is solved for the automobile industry. And this is really sad because you go on the news like in Yahoo and stuff, and you're watching these dealerships go, hey, business is great. Business isn't great. You sucker punched the public. That's it. And that's a sad commentary on our government. That's why I live in this world. So many people are comparing, like Germany's healthcare or Japan's healthcare. I have a friend that his wife is Japanese, and they had both their children in Japan because of the healthcare was cheaper. And he asked me, he goes, hey, it's cheaper. I wish America had this kind of healthcare. And I just smiled at him and I said, hey, they don't have the military that we do. They get it from us. We're their military, and so they can take a huge part of their gross national and throw it to healthcare. But it's still not perfect, and it's still not the best. Meaning, it's still not making money. They're still telling people what they can make and how much they're going to pay for something. And do you really want a bureaucrat doing that? Think about it for your own business. Let's say you're a window washer, I don't know, or anything else, and some bureaucrat comes in and says, no man, not everybody can have their windows washed. So what we're going to do is we're going to make sure everybody can have their windows washed, and these are the new guidelines, and these are the prices that you can charge. Now, a free market situation will have competition do that for you. And when that magic area comes to where you cannot compete because it's too low, you will either go out of business or they will go out of business. And they will find an equilibrium. That's the way business works. But that's not the way that they have planned. So, Germany and Japan, they sit off the backs of the American people. And, we pull out, their medical goes to hell. That's just the way it is. Probably if we pulled out of all the countries that we're in, Italy and the rest of them, not only would their medical crap take a crap, but their whole life and their way of doing or living would take a crap because they're so dependent on us. And then they have the balls to sit there and say, hey, we hate you. It's like, okay, you hate us, let's just leave. I'm all for that. I'm all for just taking off and going, because it's like this world, man. It's like cartoon land. We live in cartoon land. So I have an HSA, which is it's tough, but if you plan, it's a good thing. See, anything $5,000 and down, I pay for. All my doctor visits, I pay for. So if it's $150, it comes out of my butt. I pay for it. But if I was to have a heart attack or a major something, or my wife or my child, I would pay the first $5,000 out of my pocket. And the rest of it would come from my insurance. That's what it's for. It's very affordable. I think I pay for something for it a month, which is a heck of a lot cheaper than I would have paid if I had got Cobra. Even I think it was 15 15, 18 years ago, I could have got Cobra, and I think that was at $800 a month back then. And it wasn't all that great. I still had to have a co-payment. I think that was an HS. No, that was a whatever. I can't even remember all the different plans, but it was it's terrible. I like the way I am now, and then my saving money that can be saved and put away for the future. So if you're a healthy person, you might consider that. Anyhow. I hope everybody's doing well. Take care and eat right. You don't want these little bureaucrats giving you a little, let's have a meeting here. How old are you, Mr. So-and-so? Have you ever considered dying? Have you ever considered just letting go? Take care.